Take you straight to the White House now, the Biden COVID team briefing.
Achieving this goal is a direct result of deliberate, aggressive actions guided by the president's whole of government national strategy to end the pandemic. Now, thanks to the American Rescue Plan, we will have the resources to fully implement this strategy and put the pandemic behind us. I'm currently at a community health center in New York City, where I joined Leader Schumer on a tour of the Ryan Health Center to see what's working, thank the folks on the front lines, and hear what else we can do to support them. I also want to thank Leader Schumer for his critical leadership in passing the American Rescue Plan. Today, I'll give a brief update on our three-part strategy on vaccinations. First, more vaccine supply. Second, more vaccinators in the field. And third, more places to get vaccinated. On vaccine supply, the president has taken aggressive action to move up the production timelines for all three vaccines, Pfizer, Moderna, and Johnson & Johnson. As a result, by the end of May, we will have enough vaccine for every adult in the United States. This week, about 22 million doses went out to states, tribes, and territories, and through the federal channels, including pharmacies and community health centers. That's more than 2.5 times the weekly supply that was being distributed when we took office. On vaccinators in the field, we've deployed nearly 6,000 federal personnel to serve as vaccinators and support vaccinations, including over 2,000 active duty military men and women. At the president's direction, that number will grow to more than 6,000 active duty troops over the coming weeks. On places to get vaccinated, we've increased the number of convenient and trusted places for people to get a shot. We provided federal support for more than 600 community vaccination sites. We've administered more than 1 million shots at federally run community vaccination sites across the country. And more than 60% of those vaccinations have been administered to minority populations. That includes 2 sites right here in New York City, one in Brooklyn and one in the Queens. And the American Rescue Plan will allow us to continue to increase the number of community vaccination centers. We launched the federal pharmacy program, which has allowed millions of Americans to get a shot in their local pharmacy, the same way they get their flu shot. Last week, the president committed to doubling the number of pharmacies participating in the program. Already, people can get vaccinated at one of 14,000 pharmacies around the nation. For Americans who aren't near a pharmacy or a community vaccination center, we've supported more than 500 mobile clinics to meet people where they are. And today I'm at the Ryan Health Center. Community health centers like Ryan Health serve 30 million people. 60% are people of color, and 2/3 of patients are below the poverty line. The administration is already sending vaccines directly to 250 of these community health centers. By the end of April, we will deliver vaccines to an additional 700 community health centers. This work is a result of the Biden administration's partnership with state and local officials, federal workers, and the nonprofit and private sectors, and it is leading to significant progress. As you can see in our weekly vaccination progress report, the current 7-day average is 2.5 million shots per day. 2.5 million shots per day, that's a new record pace that we will continue to build on. Importantly, now 2 out of 3 adults age 65 and older have gotten at least their first shot. This is critical because 80% of COVID deaths have been individuals 65 and over. Given our progress on increasing supply, coupled with increasing the number of vaccinators in the field and creating more places to get vaccinated, the president announced last week that all adults in the country will be eligible for vaccinations no later than May 1. All adults eligible no later than May 1. Finally, I want to provide an update on how we are working with our North American partners on efforts to stop the spread of COVID-19 across the continent. As part of the national strategy to end the pandemic, the United States is committed to engaging with the international community and supporting global efforts to address public health and humanitarian concerns. Under the president's direction, the U.S. re-engaged with the WHO on day one of his presidency. We committed to providing the most funding to COVAX of any country in the world, $4 billion. We also announced with our Quad partners last week that we are working to achieve expanded manufacturing of safe and effective COVID-19 vaccines at facilities in India. And now, given our visibility into vaccine supply in the US, we're able to announce that we're lending a portion of our releasable AstraZeneca vaccines to Mexico and to Canada. Our approach to this wartime effort is to have as many tools in our toolkit as possible. Right now, we have 3 effective vaccines that went through a rigorous review process to be authorized by the FDA. We have other vaccines going through that process now, including one from AstraZeneca. As we await the results of these trials here in the US, many countries have already approved AstraZeneca, but need more supply. That includes Canada and Mexico. So balancing the need to let the approval process of the AstraZeneca vaccine take place here in the US with the importance of helping to stop the spread in other countries, we will loan a portion of our releasable AstraZeneca vaccine to Mexico and Canada. This action will allow our neighbors to meet a critical vaccination need in their countries, providing more protection immediately across the North American continent. In total, we will loan Mexico and Canada around 4 million doses. To be clear, this loan will not reduce the available supply of vaccines to Americans. The doses we are loaning are not approved for use in the United States. No American will be without a vaccine because of this action. With that, I'll turn it over to Dr. Walensky.